ask you first of all, what you know, what has your state learned about this new COVID variant or any of the others? Obviously, there's one in South Africa that people are concerned about now. Do you think this is something that we should expect as we start to sequence more and more of the COVID strains that are out there? We know the one that was discovered in your state was at a nursing home, right? So it seemed unlikely that it had come in from anywhere.
So thank you, Kelly, and probably a better question for a doctor and a public health expert and a scientist. Certainly from our perspective, we're proud that Colorado scientists were the first to identify the United Kingdom strain here in Colorado. I think we expect it's likely in most states. I think it's since been found in several states. There's a lot of unknowns about it as well, too. Does it truly spread at a faster rate? Will the vaccine be as effective against it? It is not yet the dominant strain in Colorado. I don't think it's a dominant strain in the other areas that have it too. How do we know that? Because we've screened hundreds, even thousands of samples. We've just found the one confirmed case, and then on the initial screen, they can get the positive indicators and then go into the RNA screen, which takes several days more, which we expect to have additional cases identified that are likely as well. One more point as well on that. There's a lot that's unknown about the different variants. I think it was widely known that the virus mutates. There's hundreds of variants at this point. That's how they can trace whether it came from Italy in the first wave or from Arizona in summer. But the question is, do any of them have different health impact or levels of contagion? The data around this one from the United Kingdom would seem to indicate that it has the same health impact, meaning it doesn't, the same hospitalization rate, same death rate, hospitalization rate 10-12%, death rate 1-2%, but is more contagious. And that would obviously be a problem if that catches on across our country.
100%. I appreciate you sharing what you know. Like I said, with the caveat, of course, you're not a medical professional, but as somebody, so to speak, on the front lines. Let's talk about the effort in actually getting your population vaccinated and the 72-hour rule. Tell us about that and what efforts you think can help, with all the progress you've had, to speed up getting shots in arms, so to speak.
So we're at about 2% inoculated. I was saddened to see we weren't quite red on that last map. If you had another gradation of color, we would have been just on the fringe of being red, because we're one of the top states for percentage of vaccines that are out the door. I think we're probably the next one right after those. There is a lag, first of all, so it's important that people know that the reporting, and I think it's the case for all the states because it's CDC reporting. There's up to at least a 3-day lag on reporting, meaning when it's put in somebody's arm, the state and CDC. We have to find out about it within 3 days, but it could be a full 3 days till that's acknowledged, and it could be 1 or 2 days at times. Here in Colorado, what we've done is with all of our partners that are delivering the vaccine to people 70 and up, that's the members of the general public that we're giving it to right now. We expect to have that done in about a month and a half. Hospitals, community health clinics. We say, look, here's the vaccine. You have 3 days on the clock, 72 hours. Use every dose for people age 70 and up, and if they don't, we simply reassign it to another partner who can successfully get that into the arms of somebody that's 70 and up.
Shepard Smith here. Thanks for watching CNBC on YouTube.